All right, welcome to the month of March Board of Health meeting for City of Revere. Can everyone please stand for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Great, thank you. So first I'll just introduce the Board of Health. So my name is Dr. Drew Bunker. I'm the chair of the Board of Health, and with me tonight for the first time is Kathy Savage. She is a new board member, and we're glad to have her here tonight. If you don't mind just saying a few things.
Okay, thank you. As I said, my name is Kathy Savage. I'm a nurse practitioner. I've done a lot of volunteer work with the city during COVID, did a lot of the COVID vaccines. I'm also an active volunteer for the food bank for the veterans. I'm a lifelong resident.
Excellent. It's great to have you here. And then we have another board member who couldn't make it tonight, new board member Vivian Catano. She will also be starting, and she'll be here next meeting. Next, introduction of other people here. So Lauren Buck, Director of Public Health, is here. Paula Sepulveda, who is the Board of Health Clerk. We have Carrie Ann Salame, you know, I went for it, who is the SUDI Program Manager. Nicole Palermo, who is the Mental Health Clinician and Social Worker for the City of Revere. Also in attendance, we have Cheryl Sabara, who is a lawyer with the, who is Executive Director and Senior Staff Attorney with the Massachusetts Association of Health Boards. Thanks for coming. Great, so first thing we do is we approve the minutes from the last month's meeting. So I'm gonna ask, Kathy wasn't here last meeting, but, oh, you have the meeting minutes? Oh, okay, great, okay. So yeah, so I just wanna ask you if you approve the meeting minutes from last month.
Yes, I approve of the minutes.
Great, thank you, me as well. All right, next is gonna be the Public Health Communicable Monthly Report with Lauren Buck.
Thanks, Dr. Bunker. For the month of March, just wanted to report some things about our influenza and COVID numbers again, as I usually do. Our influenza numbers are still high at 168. Those range from 2 months to 97 years old. Our COVID numbers are declining, as many cities and towns throughout Massachusetts are seeing. We had 50 confirmed cases over the last month that range from 1 month to 96 years old. I also just wanted to bring forward one communicable disease that we saw over the last month, brucellosis. It's a bacterial infection spread mostly from animals to people via unpasteurized dairy products. Symptoms may include joint and muscle pain, fever, weight loss, and fatigue, and treatment is antibiotics. I wanted to highlight that one as it's something we don't typically see here in Revere, and just a reminder about the risk when you ingest unpasteurized dairy products. Finally, some public health updates. On March 18th, 2024, the CDC issued a Health Alert Network advisory to alert health providers to the global and domestic increase in measles cases. This has been on the news recently, so I just wanted to make sure I talked about it, and to provide recommendations about how to reduce the occurrence of new measles cases and outbreaks in the U.S. Firstly, schools, early childhood education providers, and healthcare providers should work to ensure students are current with MMR vaccines. The Public Health Department is a provider of childhood immunizations, and we work very closely with Revere Public Schools. And so we are obviously making sure that we target MMR very closely over the next couple of months. Secondly, all U.S. residents older than the age of 6 months without evidence of immunity who are planning to travel internationally should receive MMR prior to departure. And finally, healthcare providers should consider measles as a diagnosis in anyone with a fever, and generalized maculopapular rash with cough or conjunctivitis who has recently been abroad, especially in countries with ongoing outbreaks. Secondly, in March, the Department of Public Health launched a health equity plan to address racism as a serious public health threat. The Massachusetts Department of Public Health, they've launched a strategic plan to advance racial equity. The plan calls for, among other objectives, implementing a data equity framework to address health inequalities in Massachusetts reflected in all future key online dashboards and reports, including data disaggregated by race and ethnicity. supporting an all-staff participation in a racial equity training series with the goal of 85% of managers and 60% of non-managers completing this training, improving DPH's procurement systems, and establishing a DPH cultural assessment racial equity staff survey that will begin to measure what constitutes a collaborative and equitable culture that allows staff to fully participate and belong. So obviously this health equity plan is at the state level, we're at the city level, but I just wanted to highlight that as it's an important measure that I think a lot of us are going to be moving toward in the next several years. Finally, in late February, the CDC revealed that norovirus has been surging in the northeast part of the U.S. Norovirus is a highly contagious illness that causes nausea and vomiting. The most common transmission vehicle for norovirus is contaminated food. While surveillance data show an increase in positive test results nationwide, as is typical for norovirus during the winter months, the northeastern United States have been hit especially hard, with a 3-week average of 13.7% for positive norovirus tests. Those tests have held above a 10% positive rate since December 23. Basically, the northeastern United States has been seeing a big increase in this specific type of illness. I just wanted to remind everyone that proper hand washing during meal prep before and after using the bathroom is the best way to prevent the spread of norovirus. And that's it.
Great, thank you, Lauren. Next, we're going to get a presentation from Cheryl Sabara.
Good evening, everyone. Thank you very much for having me. I was asked to come to the Board of Health meeting to speak about the legal authority that boards of health have. It's pretty unique in the United States, the amount of legal authority that local boards of health have. Next slide, please. As attorneys always say, I do not represent the city of Revere. Your city solicitor's office does that, and I'm here to provide legal education and some technical assistance. Next slide. So when we're looking at the legal authority to regulate public health and safety, in Massachusetts, we look specifically at Chapter 111, Section 31. Chapter 111 is the section of our law that deals with local public health. And when you're looking at public health law in general, the federal government really just provides minimum standards. They're the floor. We can be stricter than the federal government. We can't be less strict than the federal government, but we can be stricter. And if you look at the cases from the Massachusetts Supreme Judicial Court, which is the highest court in Massachusetts, you will see consistently that the court has upheld the legal authority of boards of health to make reasonable public health regulations. And the most recent one was actually from the town of Brookline. This was passed, it wasn't done as a regulation, it was done as a bylaw, but the same rationale applies where, and this was a decision just this month, where it was a case called Six Brothers, Inc. versus the town of Brookline, where the town of Brookline, and I won't go into all the details, it was a tobacco-related case. They basically banned the sale of tobacco to anyone who was born after January 1st of 2000. They were sued, it went up to the SJC, and the court upheld the law saying that the town could be stricter than the state law that prohibits the sale of tobacco to anyone under the age of 21. And the rationale for public health law comes from the same power that police and fire have to protect the health, safety, and welfare of its residents. But we don't always look at public health as having that same police power. Actually, the zoning board has that police power. Zoning isn't just about where you should put a building because it looks better or not, or whether it's commercial or residential. They're there also to protect the health, safety, and welfare of its residents. And we do that even at the expense of an individual's freedom. And we also do that even at the expense of a business. A business has to yield to the paramount power to protect public health, and we need to do this balancing test constantly between privacy rights and public health. We regulate individual behavior a lot. We regulate it when we require motorcycle helmets, when we don't permit lead paint. We do regulate personal behavior at times. Next slide, please. And again, I'm not going to go through this again. I will just mention that a public health regulation that a 3-member or 5-member board enacts stands on the same footing as a state statute, a city council ordinance, or a state regulation. They're just as, they're the same, they're a law. They're a law that the residents need to comply with. And if you're going to challenge a law that the Board of Health passes, the court will not substitute its judgment for the judgment of the Board of Health. The challenger has to prove that there is absolutely no conceivable ground upon which that regulation could be upheld. And the best example of that is a case in Cambridge back in the 80s, where Arthur D. Little came to Cambridge with the intention of building a plant that would manufacture chemical warfare weapons. The Board of Health in Cambridge at the time enacted a regulation that prohibited the manufacturing of chemical warfare weapons within the city of Cambridge. Arthur D. Little sued. There were 3 reports that were produced as a result of that suit. One was done by the federal government because there were federal funds involved. One was done by the city of Cambridge, the health department, and the other was done by Arthur D. Little. And all 3 reports concluded that to a 99.9% degree of certainty, there would be no public health risk with this business coming into the city. The court ruled in favor of the city. And the rationale was, if the Board of Health thought there was a 0.1% chance of injury or danger to the residents and the workers in the city, they had the authority to enact that regulation. The court was not going to substitute its judgment for the judgment of the Board of Health. So that's an example of the almost plenary powers that boards have to enact public health-related regulations. Next slide, please. And again, they're not going to weigh the evidence or find facts. They're going to defer to the administrative body, which is what the Board of Health is in this kind of a case. Next slide, please. And when you're enacting a regulation, and the plain meaning of the words in the regulation are what is what the board and the court will look at. So a reasonable person should be able to explain and understand the regulation that you've enacted. This was a case in the town of Yarmouth where Cumberland Farms sued the town because the town fined Cumberland Farms for having a flavored product which was against their local regulation. The product wasn't explicitly labeled a product, it was called Jazz. So the board determined whether or not this product was actually flavored. Next slide. So what the board did in order to make that determination is they did a Google search. And, well, we did the Google search for them. But we found, all of these representations online that said Jazz has its own unique sweet flavor. The most popular flavors include Jazz. Next slide, please. And the Cumberland Farms claimed that, and we also smelled the product. We opened it up and we smelled it. And what the law says is that if the regulation said a flavored product is a product that has a taste or smell other than tobacco. So we opened it up and we smelled it, and it smelled really, really sweet and citrusy when you smelled it. So the Cumberland Farms claimed that that wasn't sufficient. We didn't have any scientific evidence that it was a flavored product. And the court ruled that that's fine. You don't need science to tell you whether a product is flavored or not. And health inspectors use smell all the time to determine whether a restaurant has odors, whether a pool flotation device smells like mildew, waste receptacles. We use our smell. Next slide, please. And I just put this in because I think does anyone remember who these guys are? They were the tobacco industry executives swearing before Congress that nicotine was not addictive. Just thought I'd throw that in. So again, what the court said was that, all you need to do is determine whether or not it smells like something other than tobacco, and you don't need a scientist to determine that. This just happened very, very recently. It happened last summer, where the Chelsea Board of Health fined on a product called Newport Non-Menthol. And we did the same thing. We looked at the advertisements, we tasted, you can't really smell menthol, but you can taste it. And we tasted it, and it was minty, and it tasted like menthol. And Chelsea fined on the product, and R.J. Reynolds challenged it at a hearing. And the argument that R.J. Reynolds and their attorneys used was that, as a matter of science, the chemical that they used to create the menthol taste, you can't smell it or taste it. It's a chemical that you just can't smell or taste. Next slide, please. Well, I guess I should tell you the end because you're not here for the afternoon presentation. So they said, but when you put that product into a cigarette, it changes the taste of the cigarette. But R.J. Reynolds said, we basically didn't understand science well enough to understand their argument. And one of the members of the Board of Health is the chief pediatrician at Mass General's and a professor at Harvard Medical School, and he begged to differ with the chemist that was there, because of course they brought their own chemist to testify at this hearing, and he begged to differ with him and said, I think I understand science probably as well as you do. And in any event, Chelsea ended up ruling that, yes, this was a flavored product, and R.J. Reynolds did not appeal, which we were very surprised about, but they didn't. Another case, which I really like, and I won't bore you with all the details, but we got a really good definition of what public health is from this case. It was another tobacco case, and what the court said in this case, and it was about prohibiting smoking in private clubs. And what the court said was, public health isn't about geography. The fact that the club is private really doesn't matter. It's about protecting the health of every member in the community. And when you're looking at a private club, it was such a disingenuous argument because they're regulated from door to dumpster. They need a liquor license. They need an occupancy permit. They need to comply with the local liquor licensing laws. So they are regulated. And again, we regulate behavior frequently. And I will just tell you one thing that was funny. The attorney that was arguing for the private clubs was asked about this specific, we regulate private behavior. One of the justices said, well, we require smoke detectors in homes. And isn't that regulating personal behavior? And the attorney said, well, I have two responses to that. Number one, that law is only enforced when you're selling your home. You have to have a smoke detector certificate that says that the smoke detector works from the fire department. And number two, the reason for that law is to protect members of the general public that come into that home, either to visit or, you have a caterer, or you have someone clean your house. That's the rationale for that law. I always thought the rationale for that law was if you were asleep and there was a fire, the smoke would go into the smoke detector and wake you up so that you could get yourself and your family members out of the house. But evidently I was wrong, and this lawyer said that wasn't the purpose of it. Next slide, please. So as I've told you all of the legal authority that you have to enact regulations. However, just because you can doesn't mean you should. And there are some things to consider. And one is that, are you prevented by any state or federal law? And we call that preemption. And then you're going to want to look at that balancing test, that risk assessment. A lot of our public health laws are there to protect those that can't protect themselves. A lot of times our laws are passed to protect youth, or to protect the elderly, or to protect those with special needs. Or are we looking at something that's just a risk to an individual? Not that that's not important, but are we looking at something that can be handled without a regulation that affects the entire city? Next slide. And again, just because you can doesn't mean you should. Next. So some of the things that you want to consider are that balancing test. How many, what kind of a burden is this going to be to a resident in Revere? Is this reasonable? And is the intervention going to be effective? And the best example of this is a decision probably 20 years ago in Brookline, where the health department, the Board of Health, wanted to pass a regulation that prohibited the use of cell phones in cars. Is that a reasonable public health regulation? I would submit that it certainly is. But how is the Board of Health going to enforce that? I don't think they have vehicles. Most boards don't. Some do. But they don't have sirens on them. And how are you going to determine whether someone was on their cell phone? So it's a public health regulation, but you can't enforce it as a Board of Health. And luckily, saner heads prevailed, and they didn't pass that, and it was dealt with later by the state legislature with the police as the enforcing authority, which makes a heck of a lot more sense. Next slide. So in Massachusetts, as I've said, we get our authority, well, I didn't actually say this yet, you get your authority directly from the legislature. It doesn't come from city government. It comes directly from the legislature pursuant to Chapter 111. And Section 31 is the section that gives you the ability to pass local laws. Next slide, please. In addition, Chapter 111 has many other specific authority that's granted to boards of health. And we're just going to look at two of them. You can see these, and you can look at Chapter 111 and you'll see all of them. But you have the specific authority to address nuisances and noisome trades, as well as many others, including the entire sanitary code, which includes the housing code and the food code. Next slide. So nuisance is a really important one because, as you'll see here, what the statute says, what Section 122 says, is that the board shall examine into all nuisances, sources of filth, and causes of sickness within its town, which may, in the judgment of the Board of Health, be harmful to public health. And there's a book that those of us that went to law school had to read, and Professor Prosser wrote in that book that there is perhaps no more impenetrable jungle in the entire law than that which surrounds the word nuisance. So here you are getting the big bucks to enforce the to determine whether something is a nuisance and then to get rid of it. Next slide, please. So, and again, if you do find a nuisance, this is what you're supposed to do. you're supposed to get rid of it and make regulations for it, in your judgment. I wish I had time to do my liability protection slides because you'd feel much better when you know there is no liability that's going to attach for any judgments that you make. But and there is an exception for generally accepted farming procedures. Probably not terribly relevant in Revere, but it's always good to know. Next slide. So do you have any guidance in determining how to judge whether something is a nuisance or isn't a nuisance? And it's a judgment call all the time, and your judgment will be upheld, regardless of whether your judgment is reasonable or unreasonable. If it's your judgment, I shouldn't say it will be upheld, you will be protected from liability because you have the right to, pursuant to the discretionary function, you have a right to make that judgment. So you want to consider, again, some of the things that we considered earlier. Is the nuisance contained to one person or one household? Think about COVID. Could the nuisance spread to neighboring individuals or households? Could it spread even further? Could it spread out to the city? Next slide, please. And then, you want to, is there a real or potential health risk? I don't need to go through all of these, you have this, but you're going to want to look at it as how it affects health. And frequently, I'm sure Lauren deals with this all the time, but sometimes you may have two neighbors that are fighting with each other over, I don't know, water going on to one's land, or noise that's keeping them up, or lighting that's keeping them up. And sometimes there may be a private cause of action for a nuisance between neighbors, but does it rise to the level of a public health nuisance? And these are the factors that you can consider when you're thinking about that. Next slide, please. So if you find a nuisance, then, as the law says, you have to remove that. So what normally happens is that your staff would issue a cease and desist order, ordering the person to abate the nuisance, and also have them come before the board and explain how they're going to do that, so that there's a plan there that you can approve. We have templates available that Lauren's aware of if you need them for any reason. Next slide, please. Noisome trade is another one that is challenging for boards, but is really an effective strategy. And this law says that any business that may result in a nuisance be harmful to people or harmful to their property, which is really unique in the law. We're not usually looking at property interests when we're looking at public health law, but those kinds of businesses can't be established in a location unless the board assigns a location for that business. Now, normally what happens here is that the business is already in the city, and what the board does is it can put conditions on that business. In other words, you have to be open just from 7 until 5. You can't, if you're an auto body shop, you can't be sanding a car at 3 in the morning, those kinds of things. Next slide, please. So, and again, the board would hold a hearing, and if you're doing this, you want to consult with your zoning board because there are some zoning issues that come in there too. Examples would be, in this area, auto body shops. We had a situation in Somerville with a car washing facility that washed large trucks in the middle of the night because that's when the trucks weren't on the road, and that was creating a problem because it was a very dense neighborhood where this place was situated. Piggeries, by definition, are by definition noisome trades, but if they're on 5 acres or more, they're farms, and then we have to look at generally accepted farming procedures. Next slides, We'll go very quickly. Free-range piggery, not in Revere, but that's what a free-range piggery would look like. That's generally accepted. Next slide. Same thing. Next slide. This is not a free-range piggery. This was actually a dump that had pigs, where pigs lived. And these brothers were claiming that this was a farm. Next slide. And then we're done with the piggeries. Okay, next slide, please. Okay, so here's a manual that we edited, and this was edited 8 years ago, so it definitely needs to be updated. It was originally done by the Department of Public Health, then MAHB edited it, but it needs to be reviewed again. But I just want to show you the breadth of the types of laws and regulations that you, as a Board of Health, are charged with enforcing. Next slide, please. So you'll see, this is a book with several chapters, and under each chapter, there are several sections that list the specific laws that you are charged with enforcing, and you can see some of them right on there. Next slide, please, and more. And then there are more, because we don't have some of the we don't have the cannabis laws, we don't have a lot of laws. So there's a lot, and we're gonna just switch to inspections, which you folks luckily have a staff that does. But the types of inspections that boards get involved in are either the periodic ones that are done, like restaurant inspections, or the complaint-driven ones, which are complaint-driven, and they can be anonymous complaints as well. And you would go to the property that's being complained about, and if you're not let in, you can't bang the door down. You have to get what's called an administrative search warrant. Next slide. We're going to talk about enforcement just for a minute. The easiest way to enforce is to call up an establishment and say, your dumpster's overflowing, could you please get it clean? We're boards of health. We're not, while we have the police power, we're not the police. We're about compliance, not about punishment. We just want to get to yes. You know, we want the situation cleaned up. And that phone call may be all you need, or that one visit may be all you need. If that doesn't work, then we have the non-criminal disposition way of enforcing, which is a civil ticket. It can only be up to $300, so it doesn't work with all things, like tobacco sales. First offense is $1,000. And then we have the ability to file an application for a criminal complaint in district court if someone's not complying with your orders or with your regulations or with the food code or the housing code. And then we have, obviously, the health orders that are really letters sent to someone telling them to stop doing this, or come in and explain how you're going to stop doing it. And then we do have the ability to suspend or revoke or refuse to issue permits. And getting a permit is not a right, it's a privilege. So a board can suspend that permit or revoke a permit assume after the violator has been offered a hearing, because they need due process before you can take it away, but you can take it away. And then if all else fails, you can file either a civil or a criminal complaint in either the district or the superior or the housing court. Next slide. I would just say, and this is my last slide, and this was written by a senior judge of the Second Circuit Court of Appeals who has retired, and you really want to be careful before you get to court. The judicial system is the most expensive machine ever invented for finding out what happened and what to do about it. So I always go back to we're about compliance, not about punishment. And if we can, we want to stay out of court. I mean, we're seeing now how long court cases can actually drag out. And I think that's it, Paula. And if there are any questions, I'm happy to answer them. But you're probably sick of hearing from me.
I don't have any questions. Do you? No. Okay. Great. Thank you so much. So next is going to be a presentation from the Opiate Abatement Working Group. And Lauren is going to do that.
Hi. So I'm here as the Director of Public Health, and I have two colleagues coming up to present as well. We are from the Public Health Department, and we are wanted to present on the Opioid Abatement Fund strategies for the City of Revere. We want you guys to ask us questions. We are also doing this presentation to the City Council just to make sure we are getting the word out about these funds, to make sure people have a chance to ask us questions, and to just be transparent. So first we'll introduce ourselves. You guys know me. I'm Lauren Buck. I'm the Director of Public Health.
Hi, I'm Carrie Ann Salemi, Program Manager for the SUDHI office.
Hi, I'm Nicole Palermo. I'm the mental health clinician for the SUDHI office in the Public Health Department.
Awesome. And yes, okay, great. So first up, I just wanted to give a very, very brief overview of what the opioid crisis looks like here in Revere. The top bar graph is a representation of 3 cities, us, Chelsea, and Winthrop. Chelsea is in blue, we are in pink, and Winthrop is in green. Just to keep note about these statistics, and I'll explain what they are, Revere is by far the largest city of the 3 cities, and so although our opioid-related overdose deaths are much higher than Chelsea and Winthrop, we also have a much higher population. But as you can see, as throughout the country, throughout Massachusetts, Revere has seen an increase in opioid overdose deaths over the last several years. For 2020, we had a total of 21. For 2021, we had a total of 25. For 2022, we had a total of 30, which is obviously a very scary big number. We don't have official data for 2023 yet, but what we do have is Revere police data, and what we can say from those numbers is that we've estimated preliminary reports show that we had a total of 123 total overdoses in 2023 and 17 fatal overdoses. Obviously 17 is less than 30, but it's definitely 17 too many. And so the state will present official numbers later in the year, but we can use that number as kind of a guide. Next up. So I wanted to give an overview of what the opioid abatement funding actually is. Some people know about it and some people don't. Massachusetts entered into litigation with opioid pharmacies, manufacturers, distributors, because of deceptive business practices, because there was a recognition that opioids were much more of a problem than people were letting on, the distributors and manufacturers, the pharmacies. And basically, settlements came from these lawsuits in Massachusetts. And how Massachusetts decided to split up these settlement funds was, if you can see the bar graph in pink, 60% of these funds are going straight to the state as part of the Opioid Recovery and Remediation Fund. So that sits with the state of Massachusetts. 40% of the funds come to localities, municipalities themselves. We are one of 300 municipalities. Am I getting that right, Cheryl? 321 municipalities?
Part of the shared service?
No, in Massachusetts. 350. There you go, thank you. We are one of 351 municipalities. Not every municipality signed on, but most of them did. And so we get a share of the 40%. As part of the settlement agreement, certain things are required of us. The state would like us to make sure we're pooling funds if possible as part of the shared service model. I can explain that more, but basically Chelsea, Revere, and Winthrop are a shared service public health collaborative. Revere has chosen to make these monies available by appropriation, which means whenever we decide we want to spend money from this fund, we have to go to the city council to get it approved. And there's also a company that is contracted to oversee all the reporting and data for the state and for all the municipalities, and that's JSI. Next slide. Definitely not going to read all of this, but as part of the settlement agreement for the opioid funds, as something that the city signed off on saying, is that we can use for the following buckets this funding: opioid use disorder treatment, support for people in treatment and recovery, connecting people to care, harm reduction services, addressing the needs of criminal justice involved persons, and supporting pregnant or parenting women and families, including babies with neonatal abstinence syndrome, and finally, preventing the misuse of opioids and implementation of prevention strategies. So those are kind of the big buckets that we can use this money for. Next slide. this is a bunch of numbers, but basically, if I want to make sure we're transparent about what money we are anticipating receiving, what money we've already gotten, and the total number that we'll receive as of 2038 for the total amount we'll receive for the city overall. One thing that I just want to highlight here, I won't go over the individual numbers, is that you can see on the very right-hand side of the screen, maybe left-hand side of the screen for you guys, the total. Every year, all of these settlements are structured so that the lump sums are much bigger in the very beginning, and then they dwindle off in the consecutive years. So you can see by 2038, our share of what we're getting is much less than what what we'll be getting over the next several years. You can go to the next slide. So what has Revere actually spent? I can do fiscal year 2023 and fiscal year 2024, and I can let you know that fiscal year 23, we didn't spend any money. Most cities and towns did not spend any of this money in fiscal year 23 or fiscal year 24, so we're a little bit ahead. But fiscal year 23, we were just barely getting some of the money. We didn't have city council appropriation. We were still getting direction from the state in how to actually do the appropriation. So we waited until fiscal year 24. In fiscal year 24, we spent in two categories. We spent for salary and benefits, and then for miscellaneous goods and services. We will talk more about that $10,000 circle as part of the presentation, why we want to talk to you all about some of the really fun initiatives, good initiatives that we're doing with that $10,000. But you can also see in this slide that the total remaining balance as of March 2024, just checked in this afternoon about that number, is $432,490. There we go. Okay, so noted that this balance includes payments that were awarded in March 2024 from Walgreens, Tevia, Allergan, and Walmart. So those are the companies that have settled. There are still some pending settlements. Is that right, Cheryl? Yes. There are still some pending settlements from other companies. These are the ones that have settled and started their payments. And just a quick note, we got money from CVS, Walgreens, Allergan, and Tevia at Walmart just in this month. So very, very new that we got those line items there. All right, next slide. So obviously the goal is to make sure that the city spends this money effectively, that we're meeting the needs, and we have a long-term spending plan. We don't want to spend this money year after year in short-term ways. How are we doing that? Some of the things that Nicole and Carrie Ann will be able to talk about. We started an opioid abatement working group. We also want to communicate to the public, so we're working on getting a website up and running about this funding. Obviously, we want to communicate to the council and administration. That's what we're starting today with you all, and we'll go to the city council as well, and we'll try to do this at least annually to make sure you are all aware of what's going on. We really want to focus on innovative ideas, and like I just said, the goal for the city of Revere is to make sure we have a long-term spending plan. And I'll pass it off to Nicole to talk about the opioid abatement working group.
Hi, everyone. So the opioid abatement working group is part of the agreement that the city signed into that every community who's getting these monies has to have to make decisions basically on where the money is going. So it has to consist, it has specific qualifications, I guess, of what it has to consist of. So concerned community member partners, MGH primary care doctor we have in here, family of people with lived experience. So we have a bereaved parent who lost her son to an overdose, people with lived experience, either past or present. So we have someone who is actively using. We have outreach workers, community-based organizations such as Health Innovations and Healthy Streets, and people in municipal departments like myself, the SUDI department. We have school resource officers and Lauren from the public health department. What this group does is we bring a multitude of like all of our different viewpoints, because we all come from different areas of expertise around opioid use disorder. Good thing this is a practice.
Yeah.
So we all have like different perspective, different ideas. Some people are more focused on prevention, where other people are more focused on harm reduction. And with this group, we kind of are deciding what we're going to do with the money long term. We meet monthly, and we started meeting last October. So we've met every month since then. We keep minutes and agendas that eventually will be available on the city's website so that anyone can go in and look at what we're discussing and what we're talking about. The importance of having people with lived experience in this working group is that they'll be represented in the decision-making, and they're the ones that are really going through it or have gone through it, using, opioids and the effects, short-term and long-term, and on their families and loved ones. In the agreement, it specifically says that the group reflects the input of our communities, of people who have personal experience with the opioid crisis, of experts in treatment and prevention, and of staff and organizations that are carrying out abatement work. So everyone in the group fits into this category. We are ensuring that Revere is also hearing these voices, so we're gonna have surveys with gift card incentives to give out to people so we can hear from the community as well, so people who aren't directly in the working group. We're going to invite people to the working group meetings to discuss transportation assistance, regular communication with our outreach workers so we know what's going on in our homeless population communities and our opioid use disorder communities. Like I said, we'll have a website coming and possible focus groups after our initial surveys. Next slide. And then for the $10,000 that Lauren had talked about previously, we have voted and decided on what we're gonna do with that $10,000 as the group. 1,000 of it will be used for gift cards to give out to people who take the survey. $500 is put aside for a speaker to come in and talk to our working group so that we can eventually have longer-term goals, so maybe like a prevention speaker or a lived experience speaker, something like that. $2,000 will be for 6 months' worth of miscellaneous funds to be held by an outside agency, so we won't actually be holding the money and giving it out and deciding where it goes. A nonprofit that we work closely with will be holding that money. And then $6,500 will be used towards nalox boxes, and Carrie Ann's gonna get into that, and that's kind of our big project for the rest of this fiscal year. So I'll give it to Carrie Ann.
Hi, everybody. So nalox boxes, what are they? We have outdoor nalox boxes, indoor nalox boxes. What this is it's a cabinet to store naloxone. And when I say naloxone, other people might know it as Narcan. So if you hear me say Narcan and naloxone, it's the same thing. So the outdoor boxes can hold 12 kits of naloxone, which means that it would be 24 doses. There are 2 doses in each box. Those are outdoor cabinets that can withstand the weather and hopefully vandalism. Hopefully there won't be vandalism, but they're pretty sturdy. And where these boxes will be is around the city, so people are going to see these. They will be around the community we have 7 locations identified as of right now, and still looking for a couple more. So they will be outside. You might see one on Broadway, you might see one down Shirley Ave. Different areas that we have identified as hotspots of where overdoses have taken place. Hold on. Okay, and the indoor boxes are for, sorry, the indoor boxes we are going to be utilizing to do small business engagements where we can present to small businesses to encourage them to have an emergency overdose kit on their property. Next slide. Okay, so naloxone is a medication. How can it be out in public? As of this year, the FDA made Narcan a non-prescription medication. This means that anyone can access Narcan either by buying it at a pharmacy or obtaining it through a harm reduction program. The nalox boxes are and extensive to our harm reduction program in Revere. Would it be dangerous for a child, these are some frequently asked questions. Would it be dangerous for a child to get their hands on naloxone? Naloxone is a relatively safe medication. The benefits of the use for preventing opiate overdose deaths far outweigh the risk of the medication. It is crucial to note that naloxone is effective in reversing the effects of opioids, but it will generally not harm someone if opiates are not present in their system. Naloxone is not a controlled medication and has no street value. You cannot become addicted to it. I just want to elaborate a little bit on that. It is a nasal spray, much like a Flonase. There is no adverse effects. Well, I mean, I'm sure all medications have adverse effects, so I won't put that out there. However, it is a very safe medication. If you do not use opiates, it's not going to do anything. It's just not. If you do use opiates and you are using them regularly, you can have adverse side effects such as vomiting, sweating, runny nose, watery eyes, some of the withdrawal symptoms, because it does cause withdrawal symptoms to somebody who is using it regularly. I just wanted to clarify that. Does this incentivize, oh my God, drug use? Studies have shown that naloxone access and distribution does not lead to more drug use or riskier drug use. Some studies have actually shown the availability of naloxone may lead to a decrease in opioid use. Folks who are using opiates regularly do not want to use this medication. They don't, because they will go into withdrawals, and they know that. That's why it is recommended that you do not give this medication to somebody who is responsive, so that you don't put them into a opioid withdrawal if you do not have to. The only time you would use this medication if somebody is unresponsive to stimuli, and they do not want you to use it, so it does not, make them want to use more drugs. Okay, next question. What security measures will be in place and how will the Narcan be restocked? So the SUDHI office plans to monitor the nalox boxes closely and restock them from the stores weekly. We have consulted with neighboring communities who have implemented this program over the last 6 months, and they have experienced almost no issues with vandalism or inappropriate use. We also work closely with Revere PD and will update them with any of our issues or concerns.
All right, and then our final slides are just a really exciting tool that we are using to place our naloxone boxes, and that is we have a new overdose heat map that we were able to get onto our website this week. And so how do we decide where to put the boxes? We can use two things. We can use our overdose data to create a heat map, and we can use our frequent locations that we see in our syringe pickup requests that we get through the 311 department. So an overdose heat map allows us to have a physical, geographical representation of where our overdoses are happening in the city of Revere, and it helps us locate where we need to place these boxes. The map that I'm showing you is overdose data from 2022. You can go to the next slide. And here we can see 2023 and 2024. We're only 3 months into 2024, obviously, so it looks a lot different. You can also, on our map, combine all 3 years. And obviously, the spots that are in yellow are the hottest areas, and that has the most overdoses. And the spots that are cooler tones have less overdoses. And it's just a way that we can use to pinpoint the locations. And this is what we will be using in our opioid abatement working group to make sure we have the best locations for these boxes. And that is it. So please, we want you guys to ask us questions that you think the public would have concerns about, city council would have concerns about. Please fire away. Yes. Oh, you can come up and talk into the mic.
How does one access the contents of the box?
Oh, good question. So I think what you're getting at is, are they locked? Is there a code or anything like that? I'll have Carrie Ann explain a little bit more, but they are just a cabinet that you open. There's no qualifying system. You can talk a little bit more about it.
Yeah, so they're basically just a simple cabinet that holds a box. So yes, can somebody go in and take all the boxes of naloxone? Sure. If they take all the boxes of naloxone, then they must really need them. So that's still gonna save lives. If they vandalize the box, okay, then we'll replace it. Simple.
Any other questions? Go ahead, Kathy.
Yes. Are the boxes going to be like well-marked so that people know what they are? And when are you thinking of and starting to install them?
So we're looking to purchase them at the beginning of next week and looking to install them in the very near future, like May. As far as will they be noticeable? Yes, so you will see a, almost like a purple sticker, a big sticker where the boxes will be located, and it will say naloxone here, and you'll see the boxes, and they're trying to, we're working with DPW, and they're gonna try to put them on the, what are they called? Bollards. The bollards, so the big yellow,
And if you look in the PowerPoint presentation at the very top, there's an example.
Yeah.
It's a box on a light pole with like a sticker underneath that says naloxone. So they should be noticeable. We want people to notice them. We don't want them necessarily hidden.
All that information is gonna be on the website.
Yeah.
Once we get everything put in place. Once all the boxes are up on the website, we'll have the locations of where they can be found, so people can go on and see that, yeah.
Is there any training necessary to give naloxone?
yes, there's a very simple 10-minute naloxone training with just recognizing the signs and symptoms of an overdose and how to respond to it. It's very simple. I could give the training right here, right now, in less than 5 minutes. That's how easy it is. So I know folks get, afraid and don't do well in crisis situations, but it's very, very simple procedure.
Yes.
Okay, with the training, is it going to be like maybe a pictogram or something on the inside door so people will know how to use it?
It's actually on the box. The front of the box is going to tell you how to respond with 3 simple steps.
I think too, and this is more for like us, just as thought, maybe we can do a mini or quick training on like Revere TV and then link it on the website so that way people can go on and as they're looking at where the boxes are, they can kind of train themselves quickly. And people can always come into our office as well and stop in for a quick, like 5-10 minute talk and training on how to use it, but it's fairly simple once you.
Because I was going to ask you, how are you advertising it through the city so that people will be aware of it?
Oh, sorry, I just want to say, May 7th is actually Fentanyl Awareness Day. So we are going to, I know, I didn't know that either. So we're going to do a Narcan training, and it will be on Revere TV. So hopefully on that day, so that folks know how to use it.
Any other questions? Okay.
That's
Okay.
it.
Thank you so much.
Thank you.
Thank you, guys. So next topic that we're going to discuss is the chicken keeping license renewal for Iphigenie Victorin. I'm going to have Lauren take that over.
Sure. So to vote on for the board are 3 licenses today. One is for a renewal of a chicken keeping license, which I'll talk to first. Iphigenie Victorin, she submitted for her renewal on July 14th, 2023. She passed her inspection on March 5th, 2024, and the Public Health and Inspectional Department recommend that the board approve this license.
Yes, I approve the license.
Yes.
Okay.
I approve the license.
Great. Our next one is for a renewal for a beekeeping license. All 3 of these licenses fall under our urban farming regulations. Just FYI, as where they kind of what they have to do with in terms of regulations for the Board of Health. Damian DeMarco, who runs operates Cow Hill Apiaries, he submitted his renewal on February 10th, 2023. He passed his inspection on March 21st, 2024. He passed the inspection, and the Public Health Department and Inspectional Department recommend that you approve that license.
Yes, I approve the license.
I also approve the license.
Great, last one. This is a new beekeeping license. So we have 2 official beekeepers in Revere. This was submitted by Aldo G. de Oliveira. The submission date was February 21st, 2024. His inspection date was March 27th, 2024. He passed inspection, and the Public Health and Inspectional Department recommend that the board approve the licenses.
Yes, I approve the license.
I also approve the license.
Great, thank you.
Great, thank you. That concludes this meeting for this month. Thank you very much.